My name is Sean Calhoun. I am first and foremost a librarian, but I also hold the title of Dean of University Libraries. And on behalf of Gleeson Library, the Black Achievement, Success, and Engagement Initiative, the English Department, and the School of Nursing and Health Professions, I welcome you to this special occasion to celebrate Ms. Willard Harris's amazing contributions to the health professions. It's my pleasure to welcome Ogechukwu Okoye, who is a first-year nursing student and base scholar, to introduce our guest of honor, Ms. Willard Harris.
Hi everyone. As Mr. Calvin said, my name is Ogechukwu Okoye, and I am a first-year nursing major at the University of San Francisco. I am honored and pleased to introduce Mrs. Willard Harris, an example of professional achievement, dedication, service, and lifelong learning. Originally from Jackson, Tennessee, Mrs. Willard Harris moved to San Francisco in 1967 and became the director of nursing at Mount Zion Hospital and Medical Center. Mrs. Harris holds degrees from Tennessee State College, New York University, and Honoree Medical College in Nashville. In 1989, Mayor Art Agnes appointed Mrs. Harris to San Francisco's Commission on Aging, a body that administered $15 million in government money for senior citizens. Mrs. Harris was born in 1919 and turned 102 this past December. She is the oldest recreation participant in the Parks and Recreation System in San Francisco, and you find her doing aqua yoga, walking at her favorite park, the Golden Gate Park, where she loves to see the botanical garden and conservatory of flowers. We are looking forward to hearing and learning from Mrs. Harris during the conversation with Eileen Fry Bowers, Dean of the School of Nursing and Health Professions. But first, I invite Mrs. Willard Harris to share her story.
First of all, I would like to give thanks and praise for the gift of life. I am standing here in just awe of how beautifully this occasion has been for me. Stand here and look over. I would like to just call the names of everyone. There's my priest that was there that looks at me every morning at church. There's my sorority sisters. There's my family. There's my friends. There's a commissioner. It's just so many people that are here. And I do want to thank you for coming. I do accept this honor with humility and with gratitude. I also want to say that with all of that, I am also pleased to know that I'm here enjoying my flowers today as I'm able to enjoy them. At age 102 and 1 month, every flower is a blessing. I admit that I am the product of the South. Picking cotton, milking the cows, feeding the chickens, all around 4 a.m. I remember sitting in the back of the bus, the water fountains for colored and for whites. I remember poll tax even to vote. So I experienced all of that and have come through. I went to a segregated school, as you can imagine. We received our books from the white students that would sit down to us. But with all of that, I wound up graduating from high school in 1936. I later then decided, what do you do? For black students, there was really only 2 choices. We could either be a nurse or we could be, were the most sought after. Nurses were seen as bedpan carriers and bed washers. My cousin was a nurse, and I remember seeing her in that white starched uniform with the cap, going out with the one black doctor in our city to do house calls. I thought, that's for me. But again, for me, where do I go? There was only 2 schools at that particular time, Meharry Medical College in Nashville, Tennessee, and Howard University in Washington, D.C. I chose Meharry, Nashville, Tennessee, because it was close to my hometown, Jackson, Tennessee. At age 18, I decided I'm on my way. Never been on a train before, never been out of the city before, but I thought, I can do this. So here I am, seated on that Jim Crow train in the first coach, and we had the first coaches then because we would be able to get all of the smoke from the engine. Or if there was an accident, the first coach would be the ones to go. But I was happy. I sat there with my shoebox lunch. I often wonder, where do we get those shoe boxes? Because we didn't buy the shoes, but nevertheless. I had a shoebox lunch with 1 chicken, fried chicken, 1 biscuit, 1 orange, 1 apple, and here I go. I arrived at Meharry and met my other newbies. It was 8 of us. And we had our orientation. The first thing they taught us was, if you reach the elevator at the same time as the doctor, you stand back. Let that doctor go first because he's going somewhere more important than where you're going. So you stand back. The other thing we had to learn was how to make that bed. There was something about the corners of making a bed that was so important. Something about those corners was so, and how do you pass a bedpan? The other thing we learned was that we were not able to take blood pressure. That was for the doctors. So here we go. There was 3 months of orientation and preparation. If you failed that first 3 months, you were sent home. If you passed, you were on your way to being a nurse. How proud I was. Here I stood with that checkered uniform, white apron, and white cap. We only received a band on the cap for that second year. The third year, you got a second band, and you knew you were really up there at that particular time. We worked from 7 a.m. to 7 p.m. with 3 hours off. The first portion of that time, we gave baths, we made beds, we tidied the room. In the second half of our time, we packed bedpan and gave back rubs, which was so important. Back rubs, cleaned the thermometer bolts, cleaned the utility room, straightened up the blanket warmer, and stood back and waited for any other duties that may be assigned. We were not able to go and sit at the nurse's station. That was for the supervisors, for the doctors, and the head nurses. Even if the doctor came to the desk and the head nurse and supervisor said, you stood up, that the doctor did. And for us, after we did all of our assignments, we just hung back, waiting for our next duties. There was something about that that bothered me. I kept thinking, why can't we go up there and sit with everybody else? We've done all our work, and I told my classmates, I'm going to go up there and sit. And so I did. Now, let me tell you what happened. Along comes the supervisor Her name was Miss Miller. I'll never forget all these years. I remember Miss Miller. Miss Miller, come up. Miss Daniels, did you do your back work? Yes, Miss Miller. Did you clean the thermometer book? Yes, Miss Miller. Did you do this? Yes, Miss Miller. She said, now you get up and wash that chair that you're sitting in. From that day forward, my classmates knew me as a chair washer. I completed the 3 years, and matter of fact, I received an award for being the best all-around nurse for the 3 years. So, after that, I worked at the hospital as a staff nurse, head nurse, and supervisor. Because during those days, the only way you could receive money and an increase in salary, you had to go up the ladder. Nurse practitioners was not even in the horizon. We never even dawned on that. But while I was there, I decided to go to A&I State College. It's now called the University of Tennessee, where I then received my bachelor's degree and pledged my sorority, Delta Sigma Theta. I stayed there. That was in 1940. I graduated in 1941. I got my bachelor's in 1946. And I stayed at Honoree for a while and received an opportunity for a scholarship for a master's degree to go to Columbia University in New York. I went to New York all right, but I received an MRS degree instead. Then I decided to work as a staff nurse on call. And I did that in order to get in and out of the various hospitals so that I could kind of get the tenor of the hospital and see if that was a place I wanted to stay. But instead, I decided to go to the health department, and I worked as a public health nurse. And fortunate enough, I received another opportunity for a scholarship, and that was at NYU. That one I took and received my master's degree in nursing administration at NYU. That was 1954. I left New York, came to California, and decided to apply for a supervisor's job. I felt that I was prepared. My nursing degree had done me well, and I felt very well able to be a supervisor, and I got accepted. So at Mount Zion, I started out as night supervisor, assistant director, and directorship. In 1964, I became the first Black director of nursing in California. During that period of time, people would ask me, what is your job? I said, I'm in charge of the complaint department. The doctors were complaining, the nurses went on their first strike, the hospital administration said I was over budget, but nevertheless, I stayed at the helm for 8 years. During that time, we affiliated with City College with the LVN program and hired the first LVN in our program. We also established another program, which was human relations, where we took all of the head nurses, supervisors, and clerks off campus to have a retreat. We did that annually, and the hospital administrators manned the nursing department and got a real awakening of what nursing was all about. We also had monthly meetings with the staff, including the housekeeping department as well as the dietary department. That was really a good experience. But I would also say that I, even to this day, say, don't stay in one position more than 8 or 10 years. I stayed at Mount Zion for about 16 years. But I advocate that you move, even if you go across the street and do the same job over. Because once you're in a job that long, you begin to really, by the 10th year, you really want to leave, but you're afraid to leave. It is hard to go from something that you know well into something that you don't know well. You really need a change. When you begin to hate to get up in the morning to go to work, it's really time for you to make a change. And often, we don't make changes because we just don't have the nerve to do it. So very often, we need a push. I've had to push my son, who graduated in 1984 from here, USF. I have had many needs to push myself. You have often wanted to push yourself to finish that article. Push yourself to get up in the morning to go to work. So there's often times that we need a push. And I urge you to remember that when you get to the point, as I said before, when you hate to get up and go to work in the morning, it's time for a push. I do love nursing, and I urge you to enjoy your profession. We are a sought-after profession, not only here in the United States, but internationally. People are still looking and wanting nurses. Don't become callous in your profession. Work with dignity. Work with compassion. Work with honesty. Work because you love your job. Have respect for every human being. Admire and love yourself. Think first about what you can do for others. I also say that it is blessing that you can laugh. Enjoy laughter. It's good for your health. Avoid stress if you possibly can. As I say, enjoy, love yourself. Stand strong. Ask for what you want. Self-destruction has no place in your journey. You must remember that if you love yourself, then you have room to love others. I also say, don't forget what the airline stewardess said. Put that mask on yourself first. And you're not being selfish. You're being brave. You're being considerate of others. But just before I end this, because it looks like I'm just talking and talking and talking, I want to just acknowledge my family. And all of my family members, just stand up. Tell yourself. In closing, I want to say to you, don't worry about tomorrow, because really there is no tomorrow. Just one of the things I said, don't take your pain in advance. Enjoy life. I do.
Wow, what a wonderful life that you've led, and such an example for all of us. I want to go back in time to when you were, going to nursing school and when you started out as a nurse, and you talked a lot about your experiences, about the difference between the way you were treated and the way the white nurses and the white passengers on the train and so forth, and white students were treated. And so I want to know, where did the strength come for you to keep going when must not have been an easy task? Here, I'll go ahead.
That question has often been asked of me, and it's very difficult for me to say because I really felt very strongly that I needed to get out of that situation. And when I found a way out, particularly with my cousin who was a nurse, I thought this may be an opportunity and I've just got to make it, because picking cotton and milking cows was just nothing that I wanted to do for the rest of my life.
So I want to go back to your career as a nurse.
Okay.
And you talked about being the first Black nursing director in California. Could you talk about some of the challenges that you faced and some of the ways that you dealt with, being the first? I can imagine that might have been challenging. And plus, back in the 1960s, nurses were not viewed the same way that they are viewed today. So I was wondering if you could speak to that a little bit.
Well, I was, as I said, the first Black director. But one of the things that I did, I surrounded myself with other directors who was here in the city. And I was able then to communicate, this is what's happening here at Mount Zion, and how did you handle that, and back and forth. I was also very active with the California Nurses Association, and I was also very active with the Black Nurses Association. So I kept going and being involved with other people to help me understand what's going on in my situation. And it was very helpful, extremely helpful, because other directors were doing this and doing that, and I could get information and move it. At that time, it was primarily a Jewish hospital, and they didn't have any Black doctors on staff. Matter of fact, the first Black doctor was hired there at Mount Zion while I was there. So the community began to change. There began to be a lot more of Black people moving into the area. So we began to get a lot more diversity. Mm-hmm. And I think that was very, very helpful for me, dealing with people that had never seen my kind before.
So when did you retire from nursing?
In 1980, excuse me, 1984. The job also was very good because at that time we were trying to get the legislators to accept the fact that people 65 years of age and older would be more costly to keep the person in the home rather than to put them in a nursing home. So we fought that with the legislators back and forth until that was passed. And I think most people would agree that it's cheaper to keep a person in the home rather than in a nursing home. That was one of the jobs. The other job that I did just prior to that was with the grant where we were commissioned to set up clinics here in San Francisco in areas of most needed. So we set up a clinic on Potrero Hill, one on Keith Avenue and one in the Mission. And those clinics are now still going and they're part of the city. So I've done different jobs throughout and feel very rewarded that some of them are still going.
I cannot tell you how I'm just enjoying listening to you. You're an icon for us in nursing, and particularly here in California, talking to somebody who's lived history. I'm a nurse practitioner, but I'm only able to do that because of the work that you did, and I didn't realize that you were involved in that. So thank you so very, very much.
Right.
So if you were to tell our nursing students, I know you mentioned a lot of different things as you told your story, but if you could tell them one thing that you thought was the most important thing about their future nursing career, what would it be?
And as they sit there looking at me, love yourself. Take care of yourself. It's difficult for you to take care of others if you don't take care of yourself. Enjoy your work. Don't become callous in your work. Work with dignity, with patience. These patients that you're taking care of, they're in your hands.
Mrs. Harris, this has just been such a joy to chat with you this evening. And so now I would like Christiane to come up and offer a commentary.
My name is Christiane Pierre, and I am both a Black Scholar and Sophomore 1 nursing student here at USF. I am honored to be in this sacred space with you all today to celebrate Mrs. Harris with the acknowledgement of the many accomplishments, contributions, and impact she's made on all of us here, and the various different people she's cared for throughout her career as a reputable nurse. Mrs. Harris, you are the mere representation of endless possibilities. You've shown us that where there is a will, there is a way. You remind me of the importance of taking up space in places that have not always historically been arms for people of color. I can only imagine all of the obstacles and hardships you've endured throughout your life and career, so I commend you for both your perseverance and your persistence in not letting up. I'm sure Mrs. Harris and any other nurses here can emphasize with me when I say that nursing isn't always easy, and it's an ongoing, complex, but rewarding journey that one can partake in. If I could describe my time here at USF as a nursing major, to put it simply, it's like you're running a marathon that doesn't stop. Although that sounds exhausting, I wouldn't take any of it back because I acknowledge that I am in a position of privilege where I'm attending a private university, I'm receiving generous scholarships, all in hopes of pursuing a career that will bring me genuine fulfillment. So yes, even though it has a lot of workload and it may be rigorous and demanding at times, I am extremely grateful and blessed to be in this unique position above all else. On my journey to inspire younger generations of Black nurses, hopefully like how Mrs. Harris inspires me to keep going. Throughout this journey, I've learned that being able to be in spaces like this has given me the opportunity to be a part of something bigger than myself. It's about caring for vulnerable communities of people of different races, backgrounds, and beliefs that I, in collaboration with people that look like me, will have the opportunity to care for by addressing the social determinants of health disparities, and resources that vary from community to community that may impact one's health. It's about uplifting our people who have continuously been put down, as Mrs. Harris talked about previously. Mrs. Harris, you are evidence that we no longer have to be put down, and that we have the power to create meaningful change for a multitude of individuals. Your work has set the path for the journey that I'm currently on right now. What Mrs. Harris stands for, represents, and brings out to the world is exactly the legacy I want to leave behind for both myself and the next generation of Black nurses. You are truly an inspiration to all of us here, and I appreciate you for bringing your family here today, and I appreciate everyone else for coming to celebrate Mrs. Harris. I want to thank Dr. Lawrence and the School of Nursing and Health Professions for allowing me to speak today. And now I'm more than pleased to invite Aaliyah Cunningham, a third-year nursing student, to speak and join us.
I'm just holding because I'm pretty tall. So, I'm Aaliyah Cunningham. I'm a junior 1 nursing major here at USF. I'm a Black Scholar as well, and I'm also an Army ROTC, so I have a pretty packed schedule. I was born and raised in Little Rock, Arkansas. I currently live in Houston, Texas. So, like Mrs. Harris, I'm also a Southern child, born and raised through and through. And how I ended up here at USF was beyond me. So I received an email one day, and I was perplexed. I was like, what is a university all the way in California want with me? Why are they interested in me? And I saw that it was like 55,000 a year. I said, I don't think I would be able to afford that. But I applied anyways, and then I found out about the Black Scholars Program, and so I applied for that as well. And going through the rigorous interview process of writing the essays and being interviewed individually and in group interviews, I was fortunate enough to be selected to be one of the 10 scholars throughout the whole interview process to be able to come here. And like change of environment is so important. I've grown so much being here, and like school nursing here at USF is very challenging. I faced plenty of obstacles here. I didn't pass my HESIA the first time that I took it, and so that was a complete bummer for me. But I feel that that's my challenge. Like, do I really want nursing? And so I had to ask myself that, and I was like, I do. And so I'm going to keep pursuing. I'm going to be taking it in January, and I feel like that is really the perseverance that inspired me from you. Face challenges in life, you can't let them knock you down. And what Mrs. Harris represents to me is you can be from a small place and still have a large impact, and you don't know who you're going to touch, where you go, or your unique experiences from your background and how you're going to touch people. And so I want to take that with me, that your diverse background and your life experiences can bring a multitude of wide variety of outcomes and problem solving, and that's going to change the lives of many people. And so I hope to do that in my future career as a nurse and to go far. My future role and commitment is to honestly help improve the healthcare disparities that are in communities of color, and to bridge the gaps between healthcare and that's what I really want to do. I don't know how I'm going to get there, but I feel like my experience as a Black scholar, the community service that I've done in that program, and the future community service I'm going to do as a McGrath scholar is really going to prepare me for that. And thank you.
And now we'd like to go ahead and offer Professor Dean Rader to offer some closing remarks.
It's a great honor to be here today. I feel like I'm the least consequential person in this room, so it's lovely to be here. Events like tonight make me particularly thankful that I work here at USF. That a poet from the English department can talk to his friend, the librarian, who talks to his friend in the School of Nursing. And now we have this amazing woman talking to all of us. That's pretty cool. I'm also really thankful for my friend Sarah Lapiro Manica. Sarah, can you stand up or raise your hand? I credit Sarah for making today happen. So Sarah is a great author who has this amazing new book out called Between Starshine and Clay. It's interviews with really important people from the African diaspora, including interviews with two of my favorite authors, Claudia Rankin and Toni Morrison, one of my favorite scholars, Henry Louis Gates Jr., far and away my favorite First Lady, Michelle Obama, and Ms. Harris. And what I love about Sarah and Sarah's book is that she integrates seamlessly global figures who have great consequence with local figures who also have great consequence. And so I invited Sarah to come to this class I'm teaching in the English department, and she calls me up, I don't know, a day or two before, and says, hey, look, I just want to know if I can bring Ms. Harris to your class. And it might appear at first that bringing a nurse to a creative writing class is a bit of a stretch, but I feel like writers and nurses have a great deal in common. For one, we both attend to the human condition and the condition of humans. Two, at our core, at least part of our work is about healing. And three, we're all about connection. And so when Sarah said, hey, can I bring Ms. Harris? I was like, absolutely. I put on my blazer. I prepped my students. The students were stoked. And I'm waiting for them to arrive up on Lone Mountain, and I run into Sean, and I say, guess what's happening in my class? I was pretty excited. He wanted to meet Sarah and Ms. Harris, and now we're here. So I just want to thank the network of people that I work with for making tonight happen. I want to thank Ms. Harris's family for coming. I want to thank you for your amazing work. I want to thank you for participating in this night. I want to thank you for coming to help us celebrate women of color who devote their lives to service. It's a great example for all of us. And I want to end by thanking Christiane and Aaliyah. You guys are great, and I'm proud to be at the same university as you all. Thanks again, everyone.
Okay. Well, thank you to everyone who is here. Mrs. Harris, it is a pleasure to meet you and be in the same room with you. I want to present you first with a certificate and flowers to express your admiration, your gratitude, your leadership as well. So here's that for you.
Oh my, this is absolutely, I wish all of you could see it. It is absolutely beautiful. Thank you so very much.
And Mrs. Harris, as you know, this is my first time meeting you, and I'm just so honored. It's apparent from everyone here today the impact that you've had with your life. And I just thank you so much for everything that you've done. Thank you for the legacy that you're leaving with our students, with our community. It is an honor to be in your presence, ma'am. And I have one more thing to present to you, and I'll read it out loud for everyone here. It says, celebrating the life and contributions to the health professions, proudly presented to Mrs. Willard Harris for her outstanding professional achievements, dedication, and service to others, and inspiring lifelong learning. Congratulations, Mrs. Harris. And we also hope you enjoy this beautiful orchid.
I would also like to invite your sorrows up for a present for you as well.
You like one?